DOTIF, Integrative and Preventive Healthcare. The content discussed in this episode is for informative purposes only
and should not be replaced by individualized professional consultations or professional medical advice.
Hey guys, I'm Tasha.
Hey listeners, this is Guni, and we're here to discuss lifestyle medicine.
Hi everyone, welcome to DOTIF the podcast. Today we'd like to speak about approaching cancer treatments in a more integrative way, and specifically the impact of using acupuncture to support cancer patients in their cancer journey. And for this, we have Dr. Julia Hartung, a doctor of internal medicine with a specialization on Hemato Oncology, working as a senior oncology consultant at Klinik Solingen in Germany. Dr. Julia is also a licensed traditional Chinese medicine practitioner who runs her own private Chinese medicine clinic in Germany. Julia, welcome and thank you for being here today.
I'm very happy that I can talk about something which is coming from our heart. So I'm happy to be here.
Well, welcome, Julia. As Tasha rightfully said, today we're really talking about something very important with regards to oncology and how people can recover, how they can find different alternatives as they recover from cancer or as they're going through cancer. And so to kind of touch base on some of the mindset and revolves around suffering from cancer is usually a feeling of helplessness and anxiety. So as Alia Crum, a psychologist from the Stanford University says, cancer is more than just a physical disease.
Yeah, and in her research, she says, as we strive to target malignant cells with the latest cutting-edge treatments, we should simultaneously strive to provide equally precise treatments for the psychological and social ramifications of the illness.
And even if you look at the neuroscience and the psychology in the past decades, the link between, mind and body it's quite recognized right now. Having the perspective of a Chinese medical doctor, which is Dr. Hartung, and he has the oncology background, but also the traditional Chinese medical background as well. So before we dive into our conversation today, could you tell us your perspective of what integrative medicine means to you?
We take the best out of all the options we have. We know we have the kind of Western allopathic treatments, and we're happy that we have them. We can do a lot more for cancer patients and getting rid of the cancer through a lot of new treatments with less side effects. And we shouldn't say just go on and skip the Western medicine. We need it because it's anti-cancer. But on the other hand, we have learned that a lot of other factors and therapies can be very, very effective. This is the kind of medicine which is probably more individual because we look at the person and not the cancer. You could say like the allopathic Western medicine and the more holistic natural medicine. There are two important things. The first important thing is if we do complementary medicine, we have to be careful not to reduce the effect of the Western medicines. The other thing is in Germany, we all have quite often a wording of alternative medicine. It's not alternative. That wouldn't make sense. It's important. It is complementary. It is an extra next to the treatment, if necessary, through Western medicine. If we talk about complementary medicine, we have like a lot of methods. We use natural products. We talk about diets, about herbs, about supplements, vitamins. That's a big group of treating or helping patients. Then we have a mind and body medicine, like the mind and body stress reduction program, which is very, very modern and very effective for body-mind setting. But also Qigong, yoga, meditation are really important because, as you said before, the psychological problems patients have are very big, and a lot of discomfort might come because of fear and stress.
The definition of the word integrative, you've mentioned alternative and you've mentioned complementary. And I think that it's an interesting point to bring up because when we say alternative, it's it strikes as something that is out of this world or weird or not accepted, and it comes with baggage,
Absolutely.
right? And then when you say complementary, it also comes with baggage, because complementary could sometimes sounds less than, right? Because it's there to complement, but it might look like it's less good than the other. Each modality
Yep.
has its strength.
Yeah.
And that's why I think this conversation with an oncologist brings a very interesting perspective of what it really means, integrative medicine.
I have a very individual perspective of the patient,
Right.
a very individual understanding of pathology, like in Western medicine. And then I make a diagnosis, a Chinese medicine diagnosis. But I have two worlds coming from two sides with an overlap, which makes it more accurate, where we're using a very, very old medicine with the whole pathological and system and the diagnostic system. So that's very important for me. We have other systems like the Ayurveda medicine, or the homeopaths or naturopaths, which they're not just using something, they have an idea, a concrete idea why they use it in this patient. So I love that a lot, and I think it's very important for patients too.
Essentially, like integrative medicine is really a collective of the person you're seeing in front of you, and not just an isolated you're diagnosing just the disease itself, right? So I guess, like, from that, how have you seen it used, acupuncture, in your own, I guess, experience with cancer patients?
It's important to understand that we can have a lot of indications for acupuncture. The most common one is nausea. It's very easy kind of to choose points for that, but we can treat fatigue and nerve system problems. We can treat constipation. We can treat diarrhea. Women with anti-hormonal treatment, they have a lot of menopausal symptoms. We can work on that. So there are a lot of indications we actually can use. And the beauty about Chinese medicine is, again, the mind and body system. I'm treating the body, but I always have an idea where I use a point, especially because I think it's working on the spirit, or the Shen, as we say in Chinese medicine. I know that every patient who has cancer has some kind of emotional status where they need help, or where they can relax better, or they feel a lot of patients get up and just say, I just feel my body in a better way than I did before. So this kind of mind and body set is very much in the acupuncture treatments too. So that's very important for me when I do acupuncture. I do it in the hospital. I do it not that much. I'm just starting to implement it there. But in my private practice, I've seen many, many patients, and every problem with which they come with, I'm trying to think how I can help them with acupuncture.
When you see your patients, right, is your point of assessment, or like of sharing, that this is an option that's available to them? Is it something that you just share with every patient, or is it that you're tuning in to see whether this person is going to be receptive to this?
I have two work sets. In the hospital, I'm still working as an oncologist too. And so I'm trying to bring the idea of integrative oncology. Listen, you have the possibility to do more than just cancer treatment. Patients who come to my private clinic, they come because I do acupuncture, because I do work with Chinese medicine. They have been looking for it. While in the hospital, I'm trying to bring the option to a bigger group of patients who have never thought about something like that before. So that's kind of my mission, what I'm doing in the hospital, while in the private practice, I don't have to discuss it, because they come because of my experience in that field.
You have different type of cancer patients that come with different mindset with regards to TCM.
Absolutely.
And treating TCM as a complementary modality as they go through the allopathic treatments. So we have the ones who believe in, so you don't need to do a lot of convincing or explaining, I guess. Then you have the ones who they're not aware about it. What is the conversion rate, if we were to say, like, explain to people that there is maybe another aspect for them to help out with their nausea, with their side effects? Are they receptive? Is this
many of them, because they're in despair.
right?
And they're afraid of side effects. And I always call it kind of my box of tools I have, which I can use to help them to get through the treatment in a better way. There are some patients who just are perfectly fine with the Western medicine treatment. Then I don't make any effort. There are patients who just want to do everything, and a lot of stupid things too, to get rid of the cancer. Then there's the group who starts to understand that it might be a very, very good idea to get active themselves, and trying to bring them pictures to understand why it is happening. And it's quite fascinating. I've been working quite a while in a more rural area in a hospital, and they were kind of ex-farmers, or they had a lot of forest around them. And they were kind of never had an idea what Chinese medicine, started talking about nature, because that was something they could really easily understand. Understanding what's happening already relieved them a lot, because understanding is the best thing against fear.
For your specific example, comparing or bringing traditional Chinese medicine to a population that you might think that won't relate to, but by using the language that they are most familiar to, will make them click. And actually, when you think about it, even say Ayurveda or TCM, they're all based on the explanation on natural aspect or environment that are happening out there. And so it's very easy to understand, actually. And so that's why I think it's an easy way for them to actually adopt it.
I've seen some patients in my private practice just 2 or 3 times, just help them to understand what's happening. And then they find things which are just perfect for them. I always tell my patients, you have to find your own puzzle, is the German word, jigsaw puzzle, I think it's in English. And you take all the pieces which are right for you and make your own picture. And sometimes they don't need Chinese medicine, they need something totally different, but helping them to find their way and their way of helping themselves is a very, in my view, a very important task for integrative medicine.
I like how you described that, the analogy of a puzzle, right? Because that makes people feel like they are also co-creators, or like masters in the process. They are the ones who can take ownership and seize some sort of control in the situation. You know, like a big part of research is that cancer patients tend to feel a complete lack of control in the process. With your Chinese medicine practice, what is the side effect or the thing that you're treating the most out of all your cancer patients?
2 things, I guess. All GI problems, nausea, constipation, no appetite, fatigue, being tired, at the same time not being able to sleep. I think those are 2 major groups. And for the nausea part, there's good data actually, and the National Institute of Health in the United States has a list of kind of indications where acupuncture is good, and nausea is one of the top indications. And there's a lot of studies for one single point, which is just here called pericardium 6. And they have a study where they, do you know the C bands, the elastic bands with a kind of small, teach patients to put acupressure or pressure on that area. Study could show that they have less nausea doing this on the day and the next day of the chemotherapy. You can use a needle there too, embodied needle, a very thin needle under a plaster. You can put in it, and patients can do it themselves. So, and it is effective, just one point, and we're getting more and more effective if we have an idea about the Chinese diagnosis and add other points too. So that at one point is already that effective is very fascinating.
So you said GI. What are GIs?
Gastrointestinal problems.
Okay, all right.
Like everything from mouth to the end of the gut.
If we were to break it down, you have the malignant cell, right? So
Mhm.
you have oncology, a chemotherapy that would be there to remove the cell. And then you have the side effect of it, which could be all, as you said, GI effects, be
For
it
example,
nausea,
yeah.
exactly. But then there's another bit which we didn't really cover, which is potentially more the psychological aspect, which is when we're saying, you know, the loss of control, the anxiety, because again, you know, as the research argue that there's a lot of catastrophic thinking because the C word has baggage that comes with it, viewing cancer as not manageable or, you know, feeling like it's the end. That anxiety can sometimes be crippling. And have you seen, or in your opinion, the thinking on the mind overwhelm the body's ability to heal?
Yes, definitely. Trauma, fear only, it's a real trauma for some patients. And I've seen
Right.
a few patients, seeing them, looking into their eyes because I was afraid they wouldn't make it,
Right.
because they were in such a shock that the whole system couldn't really react. And I've seen quite a few patients of them, and their outcome was horrible. On the other hand, I see the patients who are really good, they're kind of good with themselves, and they have
Right.
a lot of resources to work on this trauma, and they come out in the end much better. So this is definitely, let's name it, a risk factor.
Right.
If you have a severe, deep trauma and you can't get to it, this is bad prognosis. That's the reason already the Western medicine has psycho-oncology.
Right.
And when I first talk to the patients, this is one of the things I offer them. I tell them, perhaps you don't need it now, but keep it in mind. If you have the feeling you can't do it yourself, please tell us. We have great doctors, psychologists who can help you to get through that.
Do you think TCM can help alleviate this, and how?
Acupuncture. And that's one of the things, acupuncture, finding points. Oh, I have to go a step back. If a patient comes, he has cancer. But he has a constitution too, and he has a history and a personal development too.
That's right.
And the oncologist is mainly looking at the cancer. The nurses and psycho-oncologists have the chance to get deeper to the constitutional part. In Chinese medicine, I look at the constitutional part too. I normally can't palpate cancer in a pulse, but I can see where he is or she is at that moment, and I'm treating that. I treat what I see, what they bring back with a kind of from their life. And as I said, when I treat, I always have some points where I relate to the emotional situation the patients are in. But sometimes it's so deep, they don't want to be treated. And sometimes it's so deep, whatever you do, they're so blocked with fear and trauma that you need more than one therapeutic tool to get to the thing.
For somebody who is more in an allopathic mindset, a scientific mindset, a Western mindset, when you say I see, sounds a bit too vague or too mystic.
No, I don't think so. Many of my Western medicine colleagues see that too, because we have seen so many patients, and we know if somebody has fear.
It's observation skills, right?
It's observation skills, definitely. Right. Okay, it is. You can tell if somebody is sad just looking into the eyes. Right. And if you have seen many patients and you're open to that, you can name emotion. This is not a Chinese medicine only tool. I'm not a psycho-oncologist. I know about what's going on because I've been in oncology over 20 years. But just the fact that I put them a mirror and tell what I see moves already something. And then they lie down and I'm not talking anymore, but I take needles. And then something is happening.
So what I pick up from what you're saying is that the reading or what you see in general could come in many different ways. There's the observation skill of the patient, and based on your data set of all the, the patients you've seen. So that's the observation skill. And then there's the pulse. I think that's a way of reading and seeing. And I think that the pulse reading for somebody who is more of a Western medical mindset might have issues understanding this. But there is a technique of reading pulse.
Yeah, and it's a long process to learn that, and not all Chinese medical doctors are trained in that kind of thing. Yeah.
And then there's the other bit, which is understanding the feedback of your intervention by acupuncture and how they react to your treatment.
Absolutely. Sometimes they forget about their symptoms. They come to my clinic and I talk to them first and see how they are and what kind of problems they have. And they say, yeah, I think I feel a bit better. And then I look into my previous notices of the previous charge and say, but what's about your nausea? And then they suddenly sit there and say, oh, I don't have any nausea. I didn't realize that. These patients who kind of go with the flow of Chinese medicine learn a lot about their system in their body and how to interpret that and how they feel. The quality of life is changing in most cases, not in all, but in most cases.
From this and your explaining of the experiences of your patients, can you say there's such a thing as like success rate with acupuncture?
I don't like the word success rate because it reminds me a bit more of Western medicine, like we have progression-free survival and percentage and how long they live. And I don't like that. I don't like that to use. It's really the quality of life, what the patients are describing me, and also what I feel and see. It is not, we can't measure it like that in Chinese medicine. And the one thing I know that not all patients will have or will feel that they're getting better. Then it's not their way to get through it, or they need herbal treatment, or they just need another puzzle element for them personal. So, and I'm talk to them. I'm not continuing with acupuncture if I have the feeling it's not their thing. I start to discuss what could be an alternative for them, and that's the reason you have to know what possibilities are there. So that's quite important.
What you're saying is a positive experience. Say it's not a success rate, but a positive experience of acupuncture or complementary medicine along an oncology treatment is basically, sometimes they even forget that they had side effects. So that's a measure of a positive experience.
Absolutely.
And then it's asking questions all the time and seeing if they're doing okay, and that's how you can measure really a positive experience. But I think it's a tricky question that we're asking, but it's a question that any medical doctor will ask. It's like, how can you measure that whatever you're doing is effective?
I can't use a lot of the techniques which you use in Western medicine.
And that's fair. That's fair.
Yeah.
And that's a problem with studies in Chinese medicine, because we way to think is differently, and we can't use all of the measures of Western medicine. That's one of the problems we have. Right. And it's even more exciting if we actually see a study where we can use Western medicine tools and say 70% had a profit out of some kind of treatment.
Yeah.
But that's not what I do in Chinese medicine practice. And actually, if I have a patient, I also in oncology always look what's happening with him.
Every patient is unique, right?
Yeah, I think I have to make a point for my colleagues, oncology colleagues. We know all about the statistics, we know what's to do, what we have to do, but really the big group of oncologists looking at the single person with their cancer and the whole picture, what he's bringing in. There are still doctors who can't do that, but I think to become an oncologist, you need some kind of this kind of view to get through a 20 or 30-year career with people where the majority, or not the majority anymore, but will die. Otherwise, you can't survive it if you don't look at the single patient.
It goes to show that, it's not so straightforward. And that's why having complementary medicine and allopathic medicine trying to merge together is going to be an uphill battle to measure, give it some sort of measurement of success, so to speak, right?
I see a success that all the big cancer centers actually have some kind of integrative medicine department. If you look to the big cancer centers in the state, they all have, most of them have an acupuncture department. They have Qigong, Tai Chi, whatever classes, they have mind and body classes. So and that's not because it's nice to do it, but because everybody knows it's an important part, or can be a very important part of treatment.
So you mentioned the US and how cancer centers have recognized that there is a holistic aspect to healing and recovery. What has been your experience in Europe or in Germany, because where you're currently based is in Germany? What is your experience of how people currently are approaching cancer recovery or treatment versus the US?
One of the big differences is finances, so I'm not going to talk about that, but I've been doing some research on that because, as I said, I'm going to try to bring it into the hospital where I work now. There are a lot of hospitals which have some kind of integrative department, not specifically only oncology, but for the whole hospital, for all departments, especially in breast cancer. Women already are asking for things like that. They are very well organized. Most of my patients are women. They're more into things like that right now. So the group of gynecology cancers, breast cancers are very, very well organized, and they are going to ask for something like that. And they're going to look for a hospital where they might get something like that, definitely.
Wow. So basically you're saying that it's the demand that is driving the change, and
it's the demand is I guess a lot of my colleagues say, oh God, do we really need that? But yes, it's a patient's demand to have some opportunities to do more than the Western medicine cancer treatment.
That's a good sign to see.
Definitely.
It's changing. People are also, more interested in complementary ways. And in the context of actually getting treatment, right? Is there a specific time that is good to get treatment if in your cancer recovery or cancer journey?
Whenever it's right. So I would love to see my patients before they go into treatment, because then I would see more about their very personal constitution. But they're so busy at that time with x-rays and this and that, they normally turn up with me at that time. You can do it before cancer treatment, you can do it during the cancer treatment, and after cancer treatment. I would like to see them at all 3 times. Where during cancer treatment, acupuncture is no problem. There's some things where Western medical doctors are afraid, are interactions of herbal treatment and chemotherapy, so you have to be aware of that. But at any point you can treat with acupuncture. It's not going to interfere, it's going to help most of the patients. And during the treatment, it can be really getting the infusion, it can be after a few days after, or even before the next treatment. It depends a lot on financial matters, but also who's going to bring the patient to the doctor to get the treatment.
It's very, and once again, it's because it's back to the individual, right? So it's whether or not it's suited for them before, during, or after they need to tune in.
It's never wrong to start the wrong time to start something.
And it's sad to say that it's because it's not available. It's because they are at a point, they're at a state where it's already, you know, maximum. And if it was more, I think, you know, available, I think you would see different trends. But that's my assumption, and maybe it's a wrong one. But to close off our conversation, Julia, my last question to you would be, what would you like to see more in the way we approach cancer?
Good question. Be open to things, be open for the patient to tell you what they need. One, I think, very important thing to make it more accessible for more people. Perhaps that the social security system or the healthcare system finding a way to finance patients who don't have enough money to do it. But I must say that even people who have no money and they feel it's getting better, they never discuss the price. The ones who have the money start to discuss the money and the price. To have a society which is more open to topics like that, and especially the hospitals to be more open to integrate it into the system. And I'm quite happy at the moment because the hospital is willing to pay me to start something there, even though the patient probably has to pay some price for it, but they engaged me because they want to be open for this kind of thing. So, and it's important. We have seen, and that's perhaps a good ending, we have seen extraordinary results in patients who really got active. There are some good documentaries on that people who really got engaged in the treatment, who were able to change things, who looked at their diet, their exercise, their mindset. If we see extraordinary results in patients, we see these things, and that's a good hope for patients if they know they're getting engaged in their treatment as much as possible. To have a better quality of life and even perhaps a better chance to live longer or to survive at all.
Yeah, and actually in one of our research, they directly quote that viewing cancer as manageable and recognizing the body as capable and resilient may motivate patients to participate in activities and initiating lifestyle changes, like eating healthier, getting exercise, and patient may become less afraid of side effects from treatment and cancer recurrence afterwards. So it's just like building that strength over a traumatic event. And I think that this is where it's a nice way to end, because we're really saying that at the end of the day, that there seems to be a pattern that like everyone goes through, and if we start adopting those best practice, it might help us.
Thank you for that, Julia. And before we close off completely, we do our rapid fire questions, which is kind of just to get to know you a bit better. So what is the first sign that you are out of balance?
I can't sleep, and I can't eat. Stop having an appetite. And I love eating, so this is really a kind of a sign where I say, okay, something is wrong.
What is your method of coping when you recognize those signs?
Normally I'm going into my garden. I'm just going into the earth, and I see things growing, and I plant and I water, and if I go into the garden I have a very small garden, but for 2 to 3 hours I come back and I'm fine. Or I'm going into nature and cycling, hiking. I'm into hiking really a lot. Nature and the realization at what point of the year I am helps me a lot to recover faster and sleep again better and have an appetite again. And Chinese medicine, I'm taking on a regular basis herbal treatment. So.
And what is one book if you had to pick one?
No, but
that has
that's so difficult with me. I love reading, and I'm coming out of a family who has been reading a lot. My grandfather was an author, actually, but reading is essential for me. I need to read for relaxation, for learning, for enjoyment. So reading itself is a process which is really, really important for me. The only book I can tell you is the first book with hardly any pictures in it, which I read for myself.
Okay.
And that book is still in my cupboard because that was so enormous for me. I remember the feeling that I read a book without the help of my parents.
Oh, well, and suspense. What is the name of this book?
Sienchen hinter der Mauer. Sienchen is the name of a girl, the only child of her parents, who is getting ready to go to school the first time.
This is a true reader right here.
Yeah.
Exactly.
Wow, that's awesome. Thank you so much, Julia. That was great. I liked learning about you in that sense. And thank you so much for sharing your insight. We're glad to have you here today.
Thank you very much. I enjoyed it a lot.
If you enjoyed this episode, go ahead and select that follow or subscribe button. For now, stay safe and we'll see you next week.